So I'm Jo Pisani. I've recently retired from PwC Strategy where I led our UK pharma and life sciences business, covering audit, tax, deals, but my day job was in consulting, and in particular strategy consulting to pharmaceutical and life sciences companies. I've been consulting for 20 years. Before that, I was in industry for 13 years, and I completed a Warwick MBA in 1999, which actually propelled me onto an extra phase of my career, which I'd very much like to share with you as we speak today. If you look at life sciences, you can apply a traditional PEST framework, so a classic MBA structure to what's happening in life sciences. And I think really interesting, I suppose, certainly when I was doing my MBA and some of my early strategy work, the politics part of the PEST framework used to be relatively stable. Whereas in fact now there's a lot going on the political angle, which actually then flavors the rest of the trends around it. So if I look at politically, European life sciences was dominated by Brexit and the implications of Brexit on the industry, not just for the UK economy, but also for the European economies as well. On top of that, there's been a lot of pressure on the pricing of therapeutics as well, from the EU Commission, from the UK, and also from the US, really challenging why should drugs cost so much, and actually really forcing some downward pricing on those as well. In terms of economic trends, austerity will continue across Europe, and healthcare spend as a percentage of GDP was running at an all-time high. It's around 15–16% across a lot of these countries. And you could argue that will increase as we come out of COVID as well. So what that meant, there was quite a bit of focus on drugs budgets, and quite difficult for healthcare economists to manage it, because you've got aging populations, the good news, people living longer, getting richer, but also people getting fatter. So a lot of the healthcare budget burden is related to obesity. So again, you see a lot of government initiatives trying to address obesity as its own sort of disease condition. So technology changes. Now, this has been a real explosion. So you've had novel therapeutic technologies such as cell and gene therapy, where actually be able to modify the DNA and within an individual to really deliver disease-modifying therapies, where you can train your immune system to attack cancers. So rather than having a chemical agent coming in to kill the tumor, you're actually relying on your body's immune system. Absolutely fantastic advances there. And as I said, they could really lead to disease-modifying therapy. And then finally, in terms of social changes, I've mentioned we've got an aging population with increased life expectancy. But I think we as consumers or patients ourselves have greater expectations about quality of life in old age as well. We want to age in a very active way and need therefore therapeutics and interventions to manage that higher level of quality of life. We as patients as well, I think, can exert more power through advocacy groups and expert patients in terms of to our governments asking for access, and in terms of drug companies steering some of their R&D. Now, if we look at some of the implications of that for the UK, this is some work that I did when I was at PwC, looking at the implications of Brexit for the pharmaceutical industry. And part of it was saying, and going to the government saying, look, this is an industry that you need to maintain and grow. And why is it? It's because the UK pharmaceutical industry is a world-leading country for both research and translation, with good jobs growth at 4% per annum. And these are really good value jobs at 104,000 GVA per head. People in the pharmaceutical industry generate more economic value than other industries themselves, where we invest a lot in terms of R&D as well compared to some of those industries. And in fact, if you look at the top drugs sold globally, 25% of those medicines relied on technology developed in the UK. So again, a lot of our work that I was doing at PwC Strategy was helping companies navigate industrial strategy. Pretty quickly after the referendum vote in 2017, they announced industrial strategy across all industry sectors. Having said that, I think the life sciences industrial strategy was one of the best articulated one, and probably one of the ones which really was implemented through 2 sector deals as well. One was about continuing to invest in the science base, really committing to increase UK spending in R&D to 2.4% of GDP by 2027. We're currently sit at about 1.7% at the moment. supporting the growth and the infrastructure required to develop it, including things like manufacturing, etc. Clusters, which is really getting academia to work with healthcare, to work with industry and work with the patient. A huge amount about the AI and the data agenda. An attraction in the UK is that we as UK patients, all of our data is owned by the NHS. And if you look at the NHS patient database, it covers 80% of population, about 70 years worth of data. So if treated correctly, it's a tremendous asset in terms of looking at disease progression, etc., and actually working out the best therapies. But traditionally, the business model in pharmaceuticals was if you produced a therapy that was a little bit better than the existing therapy on the market, you could claim a price premium and an increase for it. Again, with cash-strapped budgets, people are saying, well, no, we need different and more innovative commercial models. And I've just put 3 areas there on that. Maybe the one to highlight might be hepatitis C, where a lot of companies such as Gilead, Merck, AbbVie came up with a cure for hepatitis C. But nonetheless, you can imagine the budget impact of everyone being treated with that product and the implications on the healthcare system. So that led to a lot of interesting commercial models. Treat now, pay later, or pay over a period of time. When I started my career in pharma in the 90s with SmithKline Beach and now GSK, it was around spending as much as you could in terms of R&D and almost accepting that R&D was at times a bit of a game of luck. The more shots you had on goal, the more likelihood you'd find in terms of funding a therapeutic area. If you had sales people going out there, getting there on average 1.5 minutes with a GP to detail or effectively sell their product to that GP without any feedback loop really about whether something was being effective. And most of the major companies played by those. What's happened because of all of those trends I mentioned is you see really a proliferation of different business models. And again, this is strategy and work that we did. We reckon there are 4 predominant business models that are prevailing now. One is the breakthrough science developer. These are companies that focus on buying innovative platforms and really working those through and leveraging them at speed to actually develop new areas in the marketplace. Another area is looking at beyond the pill itself. What else can you do for a patient upstream and downstream of the therapeutic? So this is disease outcome innovators. These are people who really own the disease. Commercial value optimizers, they create value through scale. And typically these are the generic companies such as Teva and Sandoz, who've grown really a lot through mergers and acquisitions, and really it is a volume play. And when they buy companies, key to them is their ability to integrate those companies rapidly and at minimal cost. And then finally, at the end, you've got the traditional pharma company, which is your disciplined portfolio manager. So these are companies that might operate across different disease areas, operate in prescription drugs, but also over-the-counter drugs, and maybe also generics as well. So this is a timeline about my own background. And in fact, I mentioned I retired in December last year. So there's quite a few logos there on the right-hand side about what I'm up to now. I suppose I was always intrigued by the greater aspects around business, and that's why I decided to do an MBA. I did it by distance learning with Warwick, and that suited me very well during that period of time because I could actually practice those skills on the job. And it was a classic engineer. You tend to be quite blinkered and siloed, either by your own constraints or the way people view you. But with the Warwick MBA, I was able to converse much more along, financial language, marketing, organization, and also strategy. So it really sort of broadened my skill set. I then got intrigued by consulting. I was at GSK, I was always working alongside consultants who seemed to have information at their fingertips, working on exciting projects and different clients. So I decided to give that a spin as well. And I joined a company called Booz Allen Hamilton, that then became Booz & Co. in '99, which was one of the blue chip strategy consultancies, pharmaceuticals business. So then I switched into PwC, where I was given the opportunity to build a pharmaceutical consulting business within there. Ironically, PwC bought Booz 5 years ago, and we rebranded Booz Strategy and then finally, after 17 years with PwC, I decided I wanted to apply my professional skills outside of a professional services firm. And so I'm working with a number of institutions. You can see them on the right-hand side there, either as a trustee or a board member. And that final image on the right-hand side is me cycling from London to Paris for the Alzheimer's Society. 4 days last June. It seems a long time ago now. 140 risers, and we raised 160,000 for Alzheimer's Society. And because I work on the Dementia Research Institute, I know exactly where that money's going, which is into really excellent basic science research around dementia.
Thank you, Jo. Thank you so much for an amazing presentation. Really amazing to get to know you. I was wondering if you can tell us a little bit more about your work at the Medcity.
So Medcity was actually set up by Boris Johnson when Boris was Mayor of London, and it brings together the 3 main academic health science networks in London, so King's, Imperial and UCL. And really, we set it up to become almost a one-stop shop for companies or academic institutions from abroad to come and see, you know, how they could either locate in London or actually work for collaborations along that line as well.
And he's asking, post MBA, did you find you had to drop down the ladder in terms of seniority when you moved from GSK to Booz & Co, and how did you find that process?
I did. Now, I mean, up until then in industry, it's strange. I always worked for people who were older than me. It just seemed to be almost this thing that would happen. Then suddenly coming into consulting, I'd be working for people younger than me. So, you know, I went in initially as a manager into Booz, which meant that suddenly I was driving all the spreadsheets and everything, which I hadn't done that, you know, for a couple of years previously to that. But actually, once I'd done that and nailed the consulting tool set, I found that I was able to accelerate. And I was able to accelerate because I had greater empathy with clients. You know, I could easily say, listen, I know I was in your shoes because I was in industry for 13 years, and actually coming up with pragmatic solutions.
Isn't Hepsi business model self-defeating for the shareholders, as eventually you'll have a less addressable market?
Yes, that's right. And that's exactly what happened. I mean, this is how successful a product it was that, yes, you reduced infection risk, etc. I mean, that doesn't mean to say that, you know, you should say, listen, this isn't commercially attractive for a pharma company, because what you've done by helping and curing people is that you've made more room in the healthcare budget to be spent on other areas as well. So I don't think any of those companies for one moment thought, you know, wasn't the right thing to do.
As a strategy consultant, what has been your nature of engagement assignments with pharma clients over the years?
The organization that I led in PwC was pretty non-hierarchical. So some professional firms say that only certain people of a certain level can present or speak to clients and things. There was none of that where I was concerned, you know. And again, a lot of the people I recruited had MBAs or PhDs, etc. So in many cases, you were completely on top of the detail. So in terms of progressing through a career, I think all of the people that I'd employed were always interacting with clients, etc. So there's less of that hierarchical piece. In terms of the nature of consulting, I think the portfolio that I had was pretty broad. So it covered M&A, and it covered strategy consulting, and it covered sort of operational improvement type things. And those go in and out of flavor.
What is the kind of advice you would give to a professional from a technical background who wants to transition into management consulting? What key skills are transferable?
But certainly within PwC, we always needed to have people who were numerate as well, you know, because again, a lot of it is assessing financial information, etc. The other key things are interpersonal skills, because I mentioned we all work in teams as consultants, but you also need to have strong interpersonal skills when dealing with clients as well. Particularly if you're challenging some of their thinking, it requires a lot of interpersonal skills behind that. And I think to be curious, I mean, you know, some consultants say you need to ask 7 whys, you know, why, to get to the root of a problem. But I think it's always to be curious and think, why is that the case, etc. And if you stand back and think about that, you know, it can really make you a very, very much a sort of sound consultant.